this is my patient, and today I'm going to be doing an assessment of her hair, head, eyes, nose, mouth, ears, skin, and nails. So upon arrival, I would assess her gait. I will assess how she's walking. I will look for if she is using any assistive devices while she is walking, or if she is relying on other objects or people to walk. And then I will assess her orientation. I would ask her what her name is. What is your name?
My name is Alicia Black.
Do you know what's going on right now?
Yes.
Okay, and can you give me the date?
The date is Wednesday, June 3rd, 2020.
Okay. And I would document that as oriented times 3 because she is oriented with the person, place, and the date. So now I will assess her hands and nails. So I'll look at the back of the hands first. I will assess the skin, the texture, and the moisture. And I will see if there are any lesions, which there are not. Then I will assess the nails and look at the angle of the nails. And they look normal, which is 160 degrees. And then I will ask her to turn her hands over and look at the palms of her hands. I will still assess the texture, the moisture, and the color, and if there are any lesions. Okay. Now I will assess her head. I will see if the head is a normal head size, which it is, which I will document as normal cephalic. I will assess the skin. I will assess the texture, the color, if there are any lesions. And she does have some papules over here on this side, and some on her forehead, and some on this side. I will ask if she feels any tenderness.
No.
Okay. Now I'm going to assess her hair and scalp. I will assess for the texture of her hair, the distribution, if there's any thinning anywhere, if there's any tenderness on her scalp. You feel any tenderness?
No.
Okay. Now I'll assess the scalp to see if there's any redness or any lesions. Or any nits. Okay, excuse me. So now I will assess. Okay, next I will assess the eyes. I will first assess if they are level with the ears, which they are. Then I will assess the external features. I will look at her eyebrows and her eyelashes, the distribution of hair, if there are any lesions, and there seems to be none. Now I will assess the sclera of her eyes and check for any jaundice, and they appear white. Now I will look at her conjunctiva and assess if they're pink, which is normal, and they are. Now I will assess pupillary constriction. I don't have a pen light, but I do have this pen. And I will first assess the client to look straight ahead. I will turn my pen light on and go from the side and shine the light from the side and assess if the pupils both constrict at the same time. And then I will do it on this side. And then I would assess the 6 cardinal field of gaze. I will assess the client to look at the pen and follow the pen with her eyes only. Okay. Now I will go to the ears. I will assess the color, the texture, ask if there's any tenderness. Are you experiencing any tenderness?
No.
I will assess for any lesions. And she does not have any. And then I would take my pen light and shine it in the ear. And if there is cerumen present, that will be a normal finding. And then I'll do the same on the other ear. If there's any lesions, I'll assess the texture. And then I'll shine the light again. And then I will ask the client to occlude one ear so I could test her hearing, which is the 8th cranial nerve. And I will whisper 3 random words.
Pillow, book, seat.
Okay. Excuse me. And then I'll do the same on this ear. So now I will assess the nose. I will assess the color. If there are any lesions, which there seems to be none, then I will instruct the client to tip their head back, and I will assess the inside of the nose and look for any deviation in the septum and for any polyps. Now we'll ask the patient to occlude one nostril and inhale and exhale to assess the patency of each nostril. Okay. Now I will assess the lips, the color, if they appear dry, or if there are any lesions. Now I will instruct the client to open their mouth. Can you please open your mouth? And now I will assess the teeth and the gums, the buccal mucosa, and then I will ask the patient to please stick out your tongue. Can you say ah?
Ah.
Okay, that tests the facial nerve, which is the 7th cranial nerve. And then I'll use my pen light, and I will assess the tonsils and the uvula. Okay. And also while I'm assessing the tongue, I will assess the color of it too, and assess if there's any odor in the mouth. And I forgot to do this earlier, but I will assess skin turgor, and I'll just pinch on the skin and assess for tinting, and there is no tinting.